Hi all, I'm Dr. Shesnia, consultant radiologist at Plasma Medinostics. Today, I'm going to talk about the importance of ultrasound in prenatal care and other medical fields. So, what is ultrasound? Ultrasound or sonography is a non-invasive imaging technique that utilizes high-frequency sound waves, which gets transmitted inside the body and is reflected back to produce real-time images on the screen. What are the benefits of ultrasound? First of all, it's non-invasive, safe and painless, and there is no exposure to ionizing radiation. It is cost-effective, much more affordable than other medical techniques. It can help us in developing real-time images. Therefore, immediate diagnosis and evaluation is possible. And it is versatile. It can be applied in various medical fields. So what is the role of ultrasound in pregnancy? This can be divided into three phases. First, early, mid, and late pregnancy. In the early pregnancy phase, we have two scans, the early pregnancy scan and NT scan. Early pregnancy scan is done between 7 to 8 weeks. Here, we first of all confirm the pregnancy, estimate gestational age, the number of fetuses, and rule out any ectopic pregnancy. In the nuchal translucency scan, which is done between 11 to 14 weeks, we are usually doing it to rule out any potential risk of the fetus towards congenital anomalies like Down syndrome. Moving on to the mid-trimester scan, the anomaly scan, a detailed study of the anatomical structures and body parts of the fetus is done during the scan. We also assess the fetal growth and development. In the late trimester, we do the internal growth scan. Herein, we assess the fetal growth and development. We also evaluate the placenta, assess the amniotic fluids, and also look at the position of the baby. Now, why is ultrasound so important in pregnancy? Because it is non-invasive and there is no exposure to ionizing radiation for both the mother and the baby. And also it produces real-time images on the screen, making it for immediate evaluation and diagnosis. And timely intervention helps us in providing a healthier outcome for both the mother and the baby. Although our focus is on pregnancy, we also know that ultrasound has various applications in other medical fields, such as gynecology. In pelvic ultrasound, we view the uterus and the ovaries, wherein we detect conditions like fibroids, cysts, PCOD, endometriosis, etc. In abdominal imaging, liver, spleen, pancreas, gallbladder, we detect conditions like lipocirrhosis, cholelithiasis, pancreatitis, splenic injuries. And in urology, we detect conditions like kidney stones, cysts, tumors, etc. The bladder wall thickening in urinary bladder, also the prostatic gland enlargement and other disorders. In MSK, we look for joint and soft tissue. If there is any joint effusion, any soft tissue masses, or ligament and tendon injuries. In pediatric images, we look for conditions like intersusception, pyloric stenosis, volvulus, etc. Moving on to cardiac imaging, in echocardiography, we study the structure and function of the heart and rule out conditions like cardiomyopathies and congenital heart defects. And in vascular imaging, Doppler study is done to view and detect conditions like peripheral artery disease and deep vein thrombosis. Now, we know that ultrasound has application in various medical fields, therefore it is highly essential in modern medicine. I thank you all for your time and attention, and I hope that this short talk of mine has provided a deeper understanding as to why ultrasound is so important for us in modern medicine, especially in prenatal care. At our clinic, we are dedicated to providing the highest quality ultrasound service. We are a group of dedicated professionals who strive to support our patients and give them the best possible care. So I thank you all once again. You're always welcome to contact us for any more queries, and we'll always be ready to answer them. Thank you.